I'd like to introduce to you Dr. Angie Breidenstine, PhD. We're so excited that she can be with us for this talk this evening on such a sensitive and important issue. She is a senior psychologist in the ADHD and Behavior Disorder Center at the Child Mind Institute. Dr. Breidenstine comes to the Child Mind Institute from Tulane University School of Medicine in New Orleans, Louisiana, where she worked for 16 years, most recently as Associate Professor of Psychiatry and Behavioral Sciences. She has special expertise in infant and early childhood mental health, having had a focus on working with children ages 0 to 7 and their families throughout her career. Dr. Bredenstein has extensive experience providing therapy for children who have experienced trauma and supporting parents and caregivers in forming strong, positive relationships with their young children. So we are so appreciative that our patrons can have access to her tonight. Welcome, Dr. Bredenstein.
Thank you so much, Janine, and everybody. I'm really happy to be spending the next hour with you. Thank you for everybody who's joining tonight. I know everyone's lives are so busy, especially parents of young children, even older children. Life is very busy these days. So I appreciate you joining, and I'm glad to have this next hour to spend with you. And also thank you to the library for partnering and providing this opportunity to connect. I very much appreciate it. So as we get started, obviously we're going to talk about anxiety and fears, particularly with a focus on young children. But I will speak a little bit to kind of anxiety more generally as well. And just to introduce the organization that I'm with, I'm a psychologist at the Child Mind Institute, as mentioned, and we are a national independent nonprofit that is dedicated to transforming the lives of children and families with mental health or learning disorders. And some of the services that our organization provides are we provide a research arm that works on a number of different research studies focused on leading to better diagnosis, treatment options, new intervention opportunities for the future. We also have two clinical care services, one in New York City, where our organization started, and one here in the San Francisco Bay Area, where we provide assessments and mental health care for children and families, young adults as well. And the Child Mind Institute also does a lot of work in public education, trying to provide information via our website, which is quite extensive in terms of information about mental health care, and other public education efforts to try to reduce the stigma and misinformation about mental health wellness and about mental health services for children and families. So tonight I am aiming to talk about some of the common fears that come up in early childhood and ways that you as parents and caregivers can support young children. And then also speak a little bit to the phenomenon of anxiety more generally and ways that we support children both in early childhood and as they progress into school age and adolescence as well. So I'd like to start just by thinking a little bit about what kinds of feelings newborns have. And essentially, we know that universally there are four basic emotions that infants show all around the world. So these are the four emotions that infants can communicate and express: distress, interest, disgust, and contentment. And with these little newborns, distress is, it's not very specific, right? We just know that they're distressed and upset. Um, and then as their brains are developing in the next few months, we start to see that babies can express more specific shades of feeling. So in addition to these four kind of universal emotions in the first month or two, in the next couple of months, we see them able to experience and express joy and anger and sadness, surprise and fear. So now we see that distress can be more specific, right? It may be sadness that we can recognize in a 3-month-old, or anger or fear versus just indications of distress. So as children grow even a bit older, between 12 months and 24 months, there's a whole host of sophisticated emotions that start to come online for these young children. Feelings like guilt and envy and embarrassment, pride and shame, which are pretty complicated feelings. So by the time they're two, our young children feel this whole host of emotions. And if you see this list and think that that sounds like a lot of complicated feelings for young children who probably are just speaking in, short phrases, short sentences, it is a lot of complicated feelings. And children don't have a lot of language skills to be able and cognitive maturity to be able to understand and express those feelings verbally. So I find it's helpful just to kind of reconnect with the understanding of what kinds of emotions young children do experience despite being so young. So, as I was putting some of this talk together, I was reflecting back on some of my early fears, and if any of you want to do that, you can as well. And it's hard to remember the things I was afraid of when I was very young, like a preschooler, but I can remember being 4 or 5, maybe 6, and seeing a show called, I think it was Emergency 101 back when I was a child. And it was about, I believe it was like a fire station who would respond to emergencies. And after seeing one of those television shows, I became really afraid that our house was going to burn down because I saw a burning building in one of the shows. And that was something I was afraid of for a period of time. And eventually that subsided with some reassurance from my parents. But definitely something I remember even now. And I'm imagining some of you can remember fears that came up for you in your childhood. And if you want to put something in the chat and share with others, you are welcome to do that. Um, but again, we're going to talk about fears and anxiety and what types of fears are typical and expected, especially for young children. And I just want to mention now that experiencing fear and some anxiety is normal. Certain worries are very age appropriate and very common for children as they develop. So, when we're thinking about infants, infants have two fear responses. One is having a fear response if they feel like they're falling, and the other is having a fear response to loud noises. By the time infants are about 7 months, so between the ages of 7 and 9 months, they have a shift in their cognitive maturity. They now have achieved object permanence. They can tell that something that goes out of their sight still exists, even though they can't see it. And during this age range, we see children start to protest when they are separated from their parents, and they start to be wary of strangers. So, start to maybe shrink back when they see an adult they don't really know, cling to mom or dad or whoever their caregiver is. Whereas a few months earlier, they were pretty happy going to anybody who was a friendly face. Um, so this is a very normal and healthy part of development, having this new wariness and fearfulness of strangers come on board around this age. When children are toddlers and preschoolers, they very typically have fears of things like monsters, right? Imaginary creatures. They have fears about separating from their parents. And they also have some specific fears that begin about fear of body damage, fear of losing their parents' love, and fear of being bad. And we're going to talk a little bit about those soon as well. And just to touch on children as they're getting older, school age children tend to then start to worry more about realistic fears. So, again, they are becoming more mature cognitively and they'll worry about things like, a grandparent dying, whether their peers like them, how well they're doing at school. Um, they will worry about Any sort of, if they hear perhaps about a natural disaster on the news or someone talking about a hurricane, something of that nature, they may become worried about those events happening to them. And as children move into adolescence, some of these realistic fears, of course, continue, as well as worries about competence and school achievement. And as we all know, the worries about social acceptance become even more prominent. And also, teens are able to think abstractly. And so it's not uncommon for adolescents to start being anxious just about the idea of being anxious. Um, so I just want to point out again, these are common fears and worries that come up across the developmental span of childhood and adolescence. And these types of worries and fears can become a problem when they are of very high frequency, when they have a long duration, and when they impact someone's functioning. Many times, these kinds of typical fears come up and are managed and subside over time, but other times, the intensity and duration and frequency can become impairing to the individual. So, we're going to speak for a bit about infants and young children. So, with really young children, infants, the first year of life, first year and a half, when they are expressing fearfulness, maybe by crying, by startling, really what we can do for these young children is to pick them up, hug them, speak in soothing tones, let them know they're okay, provide that close reassurance. And as children are, gaining some vocabulary in that second year of life, we can, of course, be naming feelings for them. Oh, you're crying. You look like something scared you, things of that nature, as we're starting to help them begin a vocabulary about emotions. As I mentioned, separation anxiety begins in that 7 to 9 month age range, but will persist often for a while and may peak around 18 months, but it's a little bit different for every child. And as we're helping children cope with that very normal and very healthy anxiety that comes up for them, we can help them by practicing having short separations, maybe having them stay with a familiar caregiver, like a grandparent, someone else they know well, and leave the house, leave them briefly, and come back. So we're giving them opportunities to recognize that my mom, my dad, my caregiver comes back after a short period of time. Um, we know that when children are tired, when they are hungry, they're going to be more emotional. So we can try timing these practice separations after they've had their nap or after they've had a meal, and maybe more prepared, more able to tolerate that stress. This is a good time to start having a quick goodbye ritual, even with these very little children. So maybe it's giving a hug and a kiss and saying goodbye. I'll see you in a little bit. Maybe it's giving them, a stuffy that they could keep with them while we're gone. But having kind of a short and sweet goodbye ritual is nice because it helps that routine of children know what to expect. And we can also have a reconnection ritual when we come back. And especially when we're teaching children, helping them practice these separations, it's nice when we can incorporate familiarity for them. And that might be, making sure that when we are having separations with them and helping them get used to that, that perhaps we want to, have grandma come to our house. So they're in their familiar setting while we go out of the house for a bit, and have the separation. So having familiar surroundings, having a familiar babysitter or caregiver who's helping out while we're away. I just want to mention that in this age range that I've been talking about, the 7 to 9 month age range, when children are starting to protest when we leave them, when they are starting to be wary of strangers, this is when they have the cognitive maturity to form what we call a focused attachment with their parent or caregiver. And that means they really Well, it means a lot of things, but I'll just say briefly that it means that they look to you and count on you as the person to make them feel safe and secure in the world. Um, and so this is a very important time. Seeing that stranger wariness is a very important time period. And it means babies are really ready to form that attachment with you and really depend on you for comfort and for security. One thing I also like to mention is that sometimes, in our culture, we've got the idea that we shouldn't pick babies up too much, or we potentially could spoil babies if we pick them up every time they cry, or most of the time when they cry. And one thing that we've learned over time from some research is that when caregivers or parents pick up infants quickly when they cry, they actually are less likely to cry when they are preschoolers. And what we believe is that because they are getting prompt, responsive comfort from their caregivers, that is helping them to learn how that they can recover from difficult emotions and that there are ways to feel better. And over time, they start learning some of those skills themselves and they learn ways to self soothe eventually. So in preschool, these young children have some faith that I will feel better when I'm upset. And so we do know that getting that comfort quickly from caregivers does help children to actually not be spoiled, but to cry less and to soothe themselves better when they are older. Oh, I did want to mention, I'm sorry, one other thing that with the goodbye rituals and practicing separations, this is even more important as children are getting older, but we do want to avoid sneaking out on goodbyes. And sometimes it is hard when a child is crying, of course, it's difficult to leave. And sometimes it's tempting to say, well, I'm just gonna, get them distracted with a toy and I'm gonna sneak out when they're not looking. That actually can backfire because children then feel that they may not know when mom or dad are going to disappear. And so having that brief goodbye is actually helpful, even if it's stressful. Um, it's also helpful, though, not to prolong the goodbye for a long period of time and make it very drawn out, but to keep it kind of the short and sweet. So, moving into the toddler and preschooler age range, as children are becoming toddlers, their language is maturing, and they're in this stage that Piaget referred to as preoperational stage, which lasts from around age 2 through age 7. That's kind of rough, but children in this age range, even though they are now thinking symbolically, they're able to use language, they're pretending that, their block is a car, their imagination is really exploding. Um, and many things around them have lifelike qualities. They can, imagine lots of things. Everything's things seem magical. Um, and their thinking is still mostly based on perception and intuition. So they're not logical in the way that an older child or an adolescent would be. It's hard for children in this age range to really tell the difference between what's real and what's not, what's imaginary. And, children around the age of 4 and later, they start to rely on logic a bit more, but it's still hard for them to fully tell the difference at times between what's real and what's not. And they have a hard time explaining how and why they think what they think. So, in children in this age range, it's hard for them to understand situations from different points of view. Again, when we think of this as egocentric thinking, not in a judgmental term of being egocentric, but that children see the world from their own perspectives. So they can really easily assume that when something goes wrong, that they've caused it or that things are their fault. Um, some of the other common kinds of worries in this age range pertain to things like, storms or the dark or certain animals. And these fears can kind of come up for a while and maybe subside on their own over time. So I'd like to think a little bit with you about some of the common fears for toddlers and preschoolers. So I alluded to this idea of like imaginary creatures, talking about how young children have these really expansive imaginations. They also have fears of separation from parents, which we talked a bit about with younger babies as well. And in this age range, they have some unique fears that are coming up, which are fear of body damage, losing parents' love, and fear of being bad. So I'll talk about each of these. This fear of imaginary creatures, monsters, darkness. Um, this is a challenge with young children because we typically can't talk them out of these worries. If we tell a 3-year-old, a 4-year-old that monsters aren't real, that may not be very convincing to them, because the imaginary is just as real to them as things that are actually concretely real. So it's really helpful just to create soothing routines with children, just in general. That's reassuring. Bedtime routines can be a nice way, to create a sense of calm and safety before going to bed. And there are lots of creative things that parents can do when a child has a worry about, oh, there's a monster under my bed, or, what if a monster comes in the house tonight? That we can listen to our child and say, I understand that that is scary that you're thinking about monsters. We can check under the bed with the child and say, yeah, let's take a look. Look, your room is safe. There aren't any monsters here. Some people like to get a spray bottle, fill it with water, and say, this is monster spray. We're going to spray around your room. That'll keep the monsters away. There are different children's books that we can read with kids about monsters, about things they're afraid of. And we can talk creatively with them, like, well, we have, our dog will help make sure the monsters don't come in our house, or, we have a friendly house and we're kind people. And so if we just let monsters know this is a safe house and we're friendly here and we can make friends with monsters. So there's different ways of talking with young children, um, that engages in their imaginary world and helps them come up with coping and problem solving strategies with some of these fears. We can also praise young children when they are coping, when they're trying their best. They are being brave. We can let them know you're doing a good job being brave. I know you're going to be safe, and we can praise them for coping with those feelings of anxiety. Something else just to keep in mind, of course, is it's helpful to try to avoid scary images in media, remembering that young children do have this difficulty discerning what's real and what isn't real. So anything they see, any images, are likely to be experienced by them as something that's very real and very possible, um, to be something that could happen to them. We do want to avoid catering to children's fears. And by that, I mean, let's say a child is fearful, anxious around dogs. So if we're out walking with our child and there's a dog coming down the sidewalk, we may want to support our child. Oh, there's a dog coming. Um, I can hold your hand. We can stand to the side and we'll see if this dog is friendly. So we can try to support our child, to tolerate the anxiety they're having and provide them some extra reassurance and support that we're keeping them safe. Um, and that is helping them to cope. Catering to the child's fear might be picking them up and saying, oh, we're going to go across the street so we don't have to go anywhere near this dog. And although that can relieve the anxiety in the moment, of course, we may be inadvertently giving the child the message that, yeah, dogs are so scary that we do have to get very far away, to make sure that we're all right. So it's useful if we can find that middle ground where we're giving support and strategies, but not kind of aligning with the child that something is so fearful that we can't handle it. Of course, you are always looking out for what's safe and making sure the situation is safe for your child. And I do want to mention it doesn't mean that we have to force a child to do something that's really frightening to them. That's not a necessary or important part of life, right? So if my young child is afraid of a certain ride at the amusement park, we can be encouraging, we can talk about it with them, talk about coping options. We don't have to force them to go on a ride that they don't want to go on, for example. So we talked some about separation anxiety, and I just want to mention that it can continue through age 3 or 4, pretty commonly. And again, some of the same strategies that we discussed earlier are appropriate to continue with toddlers and preschoolers. And again, these short separations that we're giving children a chance to practice lets them know my mom and dad, my caregivers are going to come back. It helps children gain some confidence in their ability to cope. And there are some very nice books for young children. I have some of these listed at the end as well. Some examples here are The Kissing Hand and The Invisible String, that are very nice stories about separations and the love and connection that continues even when we're not with our parent or loved one. So, this fear of body damage, around the age of 2, children begin to recognize themselves in the mirror and they can name their body parts. And at this time, they also start to become obviously more aware of themselves and more aware of their bodily integrity. So, they develop this new fear of the prospect of being hurt and the prospect of being damaged. And again, they're not quite cognitively mature enough to realize that an injury is temporary typically and we get better. So they tend to worry about whether they will be permanently damaged if they do get hurt. And sometimes we see with toddlers that they might get upset at the sight of blood, or losing a tooth can be upsetting because it's losing a part of themselves. Sometimes young children are really afraid of getting their hair cut, really distressed by losing, this part of their own body. And you might even see your young child being upset, having pooped in the toilet and now it's time to flush the toilet. That's a part of myself as well in their mind. And so this can be a fear that can be a bit inexplicable as an adult, because we typically don't remember having these anxieties. But we can provide children with reassurance and comfort. So letting them know, you are okay, you are going to be okay. This it's really a universal parent reaction to like kiss the boo boo. And that is a response to this worry that comes up in this age range. Um, and even though we can, obviously, we want to provide this comfort and reassurance, we also want to be careful not to overreact to injuries. Children will also feed off of our reactions. So we want to be available and support them. But we don't need to kind of communicate a sense of alarm that might heighten their anxiety or fear. So around 2 as well, children start to become more fearful about losing their parents' love. And as you all know, this is an age where children are exploring the world more. They're more likely to get into trouble, so to speak, because their goals are not always the same as their parents' goals. And parents may need to be doing more correcting, more redirection. And young children do want to please their parents. They also want to explore the world and display their own independence. But when parents show disapproval or frustration, toddlers can become very upset because they do start to have this genuine fear that if I do something wrong, my parents might not love me anymore. And so it's helpful for us as parents, as adults, to remember that this is a natural fear for toddlers and to keep in mind that we can reassure them that we love them even when we're frustrated. Um, we can do our best to stay as calm as possible when setting appropriate limits for behavior. We, of course, still need to set limits. So it's a lot of regulation for ourselves as the adults. And sometimes just giving ourselves these cognitive reminders, right? That it takes children lots of repetition to learn the behavior that we expect from them and to learn the self-control and self-regulation skills to cooperate with what we want from them. And then this other fear that I mentioned that really begins in this age range is the fear of being bad. And what we see is this starts usually around age 3. As I mentioned earlier, these young children are able to feel guilt and are able to feel shame, which I have to say are really complicated emotions. They're hard emotions for me as an adult. Imagining these really little kiddos trying to cope with these difficult feelings. Guilt is a sense of I did something wrong, and shame is deeper feeling of there's something wrong with me. So when children do something wrong, they tend to worry that does this mean I'm bad? And they also may worry that is there something wrong with me? Again, I mentioned that preschoolers have this egocentric type of thinking where they think that things that happen around them may be their fault. So when a parent is upset, frustrated, short tempered, children can blame themselves. And as I mentioned on the last slide, young children are really learning over multiple repetitions how to behave and follow directions. And children in this age range can really only follow directions maybe 45% of the time, so less than half of the time. So if you find yourself saying, man, my preschooler doesn't listen to most of the directions I give him or her, that's not unusual. So some of the things that we can do is make sure that we're communicating, I don't like your behavior right now, rather, and making that distinct from it's not that I'm mixing up my words here. You're not bad. It's your behavior right now that I don't appreciate or want to see different. So we can avoid saying things like "stop being bad" or "that's bad," "you're bad," things like that. Um, because again, it's ideal to send the message that the behavior may not be what I want, but I love you. You're a good person. You're not a bad person. When we are thinking about how to correct young children or direct their behavior, something that's useful to keep in mind is letting children know what we want them to do instead of telling them what we want them not to do. So instead of saying, stop that, don't do that, don't hit your sister, it's really helpful to say um, clearly what we would like to see them doing instead. So instead of stop running, we can say, please use your walking feet, or don't hit your sister, stop hitting your sister. We can say, put your hands to yourself, things like that. Another thing we can consider doing is voicing our own state of mind and our own feelings to our child. So, again, because of their egocentricity, if we're frustrated, just maybe because we're tired or we've had a long day or something else frustrated us, right? We're frustrated with our partner. Young children may just assume mom is upset with me. Mom's mad at me. I'm bad. I've done something wrong. So we can voice spontaneously saying, yeah, I'm a little like frustrated right now. I'm a little mad because I'm just really tired. In these preschool years and later, it can be helpful to explain that. Okay. So just to speak a little bit more about anxiety in general, again, anxiety is a normal emotion, it's an adaptive system in our body. It really is there to alert us to danger, right? And it's not just a psychological state, it's a physical experience. You can see on this slide some of the pictures that when our body has a fear response to something, we have lots of physical reactions. Our hearts beat faster, our stomachs may feel funny, our muscles become more tense. All of these reactions are to prepare us for fight or flight, so that we could stay safe if we were under threat, right? So, why are some kids more anxious than other kids? We know, again, this is a universal emotion. Everybody has an anxiety system, a threat response system. We know that we're all different, however, and so some people are more emotionally sensitive, more prone to feeling anxious more often than others. We know that there are multiple factors that impact our level of anxiety and also impact our mental health more generally. And we understand that we all bring like a biological state to our mental health. And some children are more likely to worry or have anxiety because of genetic vulnerabilities, right? Sometimes anxiety runs in our family. Other people in the family tend to worry or be very emotionally sensitive. We also all come into the world with a certain temperamental style. So some who are more bold and ready to jump into things without a lot of hesitation. Others come into the world with a more slow to warm up temperament who like to observe and take a little time before they're comfortable in a new situation. Some children also, well, every child has different experiences in their environment. So some children may start to develop some anxiety, or their anxiety might increase after a big change in their life. For example, like starting a new school, um, different social relationships, events that happen in our family. All of these things may contribute potentially to anxiety. We know things like family conflict can make children more anxious. And we actually have learned through some really interesting research that even babies who are sleeping are able to register if there are adult voices arguing. Um, that certain parts of their brains while they're asleep will activate, meaning that they are picking up on the sound of angry voices. So we know things like that can raise stress levels. And as well, every person is different in terms of the ways that they have learned coping skills, the ways that they're feeling about themselves, how well they are interacting with others. So, all of these biological, environmental, and psychological factors play a role in how one child experiences anxiety. And again, I just want to mention that anxiety really, many people have maybe spikes in anxiety at different times that, you know, worsen for a bit and then subside. And when anxiety becomes more persistent, then it may become a concern that could qualify as a mental health diagnosis, for example, when it's causing frequent problems and affecting that child's ability to function. There are many different ways that anxiety can present. Here's a list of some in young children and as well in older children. So, with again, really young children, we see more like irritability and crying, difficulty with sleep, maybe increased clinginess. Um, and I think it's useful to keep in mind that toddlers may also look controlling and angry. Sometimes young children try to assuage their own anxiety or their worries by trying to control situations. And that can create some conflict when those efforts to control don't align with what adults want at that time. With older children, we're likely to see, or it's possible to see difficulty with concentration. Older children may be expressing their worry more verbally, talking about the things that they are afraid might happen in different situations or events. And we may see more active avoidance of activities and more efforts to seek reassurance from parents. And that might be asking a lot of questions, right? Well, who's going to be there? What's going to happen? Are you sure, that this is not going to happen? What if X, Y, or Z happens? And sometimes this reassurance seeking um, can become excessive, and children might not accept the answers they're getting from parents, and it can kind of spiral into a really difficult pattern. So let's talk a bit about ways that we can help anxious kids. And, the support of you as the parent or caregiver is really a key factor in how to help children learn to manage their anxiety. It also can be such a challenge when, a child is struggling with anxiety because parents are caught in this experience of wanting to help their child not to feel anxious and to reassure them, and also questioning, how much to accommodate for my child's anxiety and how much to kind of push them. And that can be a big challenge. So, just some general ways here are to have routines. Again, I mentioned those can be very reassuring. To spend time, especially with older children, right, talking about their anxieties and worries. And we can lead with empathy, which is really just trying to hear and understand the emotion that our child is expressing. I know many of us as adults, if we tell our partner or our best friend about something difficult we're feeling, we may not want them to jump into problem solving immediately. We may want to know that they hear and empathize with our feeling before we're ready to hear the next step. We can normalize and validate that anxiety happens to everybody and worry happens, and that there are things that we can do to cope with those feelings and to find solutions. And we can reinforce our children when they do try being brave, try coping with a situation that's hard for them. And I'll speak a bit more about some of this in the next slides. We also can teach children how to notice signs of anxiety. Maybe you start breathing faster when you're feeling nervous, or your heart is starting to beat harder. This is a signal to you that you're feeling nervous, you're feeling anxious. And that means that we can try one of these coping skills to help take care of yourself with that anxious feeling. One of the things that we are really ultimately trying to do is help kids. We're trying to create a balance between accepting their emotion and changing behavior. And I say that because we don't want to promote children avoiding the things that they're anxious about. We do want to accept that they're anxious, but help them to find ways to cope with that anxiety. And the reason this is important is because avoidance maintains anxiety symptoms. Because when something makes us anxious, there's a trigger, right? That, our anxiety starts to increase. And what we normally like to do is get out of that situation in whatever way we can, right? Because that relieves our anxiety. The problem with that cycle, however, is we escape the situation, our anxiety goes down, we don't learn that we can tolerate and get through that circumstance. We don't learn that maybe what we're worried about is excessive, or maybe our fear is not actually as bad. What the reality is not as bad as what we're fearing it's going to be. And so this is a cycle that happens a lot with children with anxiety. It can happen with us as adults with anxiety as well. Um, that getting stuck in the cycle doesn't give us that opportunity to learn I can actually successfully cope with this situation and get through it. So what we would like to do instead is to support children to validate the anxiety is there, that it's a normal feeling to have anxiety, but also that the worried voice in our mind, the anxious feelings, they are not telling us the whole story. And so there are things that we can do to tolerate that feeling, and eventually that feeling is going to subside on its own, and we will be okay and get through the situation. So some of the ways we can try to do that is first to validate, as I mentioned. So we want to listen to the child's emotion, let them express what they're worried about. We can reflect that back, which is saying something like, "Oh, yes, I hear you. You're really worried about, your first day of school because you're not sure if you're going to know any of the kids in your class," right? So we're reflecting back what they say to them, and they feel heard. And we can connect with them. Yes, I've had times in my life when I felt anxious too, or that's a hard feeling to have, right? So children feel supported and understood. And the a supportive statement, there are a couple of examples here, is a way to acknowledge to the child that the feeling is valid and also convey a sense of confidence, that you are going to be okay. We are going to be able to manage this. So might be something like, I hear that this feels scary and I know you'll be okay. We're not placing a demand. We're kind of holding both sides in balance for that child. So as parents, for children, whether they tend to be maybe on the more anxious side of life or not, we can help them develop coping skills for these tough situations. And there's a list here of some kind of general coping skills. We can teach children that, it's okay to distract our minds from things that are maybe we're ruminating on about an anxiety. So if we're going to the doctor and we're worrying a lot about what this doctor visit is going to be like, we can take a break. We can say, well, let's play a game while we're in the car on the way to the doctor. We don't have to think the whole time about the thing we're afraid of, right? We can also teach children about, how can we challenge unhelpful thinking and how can we talk to ourselves in an encouraging way when we're anxious. Like if your friend was nervous about the first day of school, what's something you might say to your friend? Um, or young children now are often on sports teams. They understand the idea of a coach, right? What would a nice coach say to you? How would they help you? And can you try some of these statements or remember saying them to yourself as well? We can start teaching children that, anxiety tells us things are going to be terrible, but we can remind ourselves that's not the whole truth. We can talk back to anxiety. And I realize we're getting short on time, so I'm going to move a bit quickly. Um, but parents can both teach skills and explicitly model coping skills to their child, right? So if you're feeling a little anxious, I have a webinar I have to do tomorrow. I'm a little nervous about it. I'm going to take some deep breaths. And that helps me to calm my body, right? So we can teach these skills, model them, and we can talk with children in advance of an anxiety producing situation. Remember, if your heart is starting to beat fast, um, or you're starting to feel nervous in your tummy, you can take your deep breaths, right? You can use your words and tell me how you're feeling, and we're going to get through it together. I'll just mention that sometimes we talk to kids about a wave, just like a waves roll in and roll back out. It's the same with anxious feelings, that they will get stronger for a while, but we can kind of ride them like a surfer, and eventually the anxious feelings will go down. And some other distress tolerance tools are using the five senses. So we might ask kids to, let's just, be in the moment right now. Look around and name 10 things you can see around you. Okay, now tell me five things you can hear with your ears. So ways to just come back to the moment instead of worrying about the future. Again, anxiety is common and it can be helpful because it's a way to alert us to danger. It's when frequency, intensity, and duration are excessive that you would start to be worried, and maybe seek input from your doctor or from a mental health provider if you are concerned that anxiety is getting in the way of your child's development or in the way of their day to day activities or in the way of their enjoyment and mood. This is when we're more concerned. So I will just leave you at the end here, have some books, some nice children's books about um, things like separation, about worry, and some books for parents that are really lovely in terms of information about supporting children's emotions, especially young children, and also helping children with anxiety. And just some websites and the location of our clinic. There are other clinics as well in the area, of course. And I do want to pause and see if there are any questions or comments. Thank you all so much for your attention and listening.
Thank you so much, Dr. Breidenstine. This was just absolutely wonderful, very helpful, and so many tips. So we do have time for a short Q&A. And for our participants, if you would like to type in um, your questions into the Q&A feature down at the bottom, you'll find it if you go down and hover at the bottom of your screen, and it's there, Q&A. And then I did have a question to kick us off. Hold on, and I will retrieve it again. Um, so, Dr. Breidenstine, this is regarding a 4-year-old. One of our participants had this question. Um, One of my co-op parents asked me to pose since she couldn't be here. My child experiences a heightened sense of fear or anxiety in response to loud noises such as the toilet flushing, hair dryer, hand dryer, soap dispenser in a public restroom, laughter or shouting in a crowded space, car horn honking, vacuum cleaner door slamming, shut, people shouting or yelling. When exposed to such sounds, she may have physical signs of distress and get upset and cry sometimes. How can I help her to feel better? And what should the parent do in such cases? And I know you started to get into that at the end, but I thought I'd bring it up.
Yeah, no, thank you for sharing that. It's so tough because it sounds like there's lots of different environmental noises that are causing her distress. Um, I think one thing I would mention, which is a little separate, obviously it's causing her anxiety and stress. I might also look into having her see an occupational therapist for an evaluation of how she's processing sound. So some children have kind of more sensory sensitivities, and loud noises or certain noises can be really distressing to them. And occupational therapists can help understand how that child is processing sensory information and do some interventions to help with that. So that might be one thing that that parent might want to explore. And usually a primary care physician can provide a referral for that evaluation. Um, but secondly, I think if there are some predictable things that make her anxious, the parents could, work with her on a few coping skills, whether it's, let's give yourself a hug, or taking some deep breaths, or saying to myself, the sound will be over soon. So just learning a few coping strategies and trying to prompt her to try those. Or, it might be asking mom for a hug. Um, trying to prompt her to try those. It won't make the anxiety probably disappear right away, but often our goal isn't to make anxiety disappear, because anxiety doesn't go away entirely, but it's learning that I can tolerate this unpleasant experience and get through it. So maybe giving her a few more coping skills, prompting her to use them, reminding her of them, and then really giving her praise and after she uses them, and saying, look, you did your breathing, you got through it, you were able to do it. So I think I'd be thinking about both those sides um, for her. Thank you.
Thank you so much. Those are fantastic suggestions. We are getting some more questions. One in our Q&A here is, as a preschool teacher, how would you suggest approaching conversations with parents when the parent's anxiety is causing the child to exhibit more frequent, intense anxiety also?
More frequent. What was the last part?
Intense anxiety. So the parent's anxiety
Yeah.
is causing the child to exhibit frequent, intense anxiety.
Yeah. That's a tough one. And I think that, when young children do have anxiety, that it's not uncommon if there are other people in the family who have high anxiety, because it does tend to run in families to a certain degree. Um, I think, I can't speak exactly from being a preschool teacher. I know from my end as a mental health person, I think I always kind of try to fall back on relationships. So one thing I would be thinking about is, what's my relationship like with this parent? And do I feel like we have some rapport? If not, is there a way for me to build a little rapport with them? And then, once I'm able to feel some connection with them, to sit down and really gently approach, this is something I've been noticing and I want to ask if it's something maybe you've noticed as well. So if you have some examples of what's happening with that child, like I don't know if it's something that's happening at drop off, for example, like maybe if the goodbye is hard, maybe the parent is kind of dragging out the goodbye because of their anxiety about leaving. I might start by asking them, what do you think the goodbyes are like, for your child? What are they like for you? And then moving into sharing some observations, like maybe asking permission. Would it be okay if I share with you something I've noticed and, something I've noticed with other kids? And then, then kind of offering a little bit of like, yeah, I've noticed that, it seems hard and seems like maybe it gets harder the longer the goodbye goes. And I'm wondering, this is what I've seen be successful for some other children and parents, with a similar situation. So I know I'm kind of hypothesizing. I don't know if it's the goodbye that's difficult, but I think I would try to come in from that relationship angle, find some common ground, and maybe ask about the parents' perceptions first, and then try to offer some observations if they're open to it.
Yes, no, I think that's very helpful because I'm sure the separation, leaving your child at preschool is a very big deal for the
Yeah.
kids and the parents. And there was actually another teacher that also put in the Q&A that out of a class of 15, she still has 3 out of 15 still cry when the parents leave. And school started 3 months ago. And
Mhm.
so your answer was getting into some helpful advice for her, I think. But
Mhm.
what do you do when you have three crying kids at drop off?
That's so hard. Oh, and probably, yeah, and they may reinforce each other a little bit, hearing each other cry. I mean, one thing that, often I have found helpful is, again, not knowing how those goodbyes are happening, but, really encouraging like a ritual and maybe the parent leaving something with the child, whether it's like a special lovey or, you know, um, I'm not sure exactly how old the child is, children are, but, like a little heart that the parent picks out and, cardboard heart or something they give them. So something the child kind of carries with them as a love object, and trying to keep like a ritualized goodbye, where there's a little routine to it and where it's not too long. Cause I do feel like often the longer it's drawn out, the harder it gets because, it kind of gives this message of like, oh, if you're so anxious, then it's not okay for me to leave you. And I feel anxious about it too. And that just makes it harder. And if the kissing hand is actually a really nice book. Again, I don't know the age of these children. Um, but it's a really nice book about a child going to school and the parent kissing them on the hand, and the child keeping that with them. So that may be an option too.
I heartily concur. I love that book
Yeah,
as a librarian.
absolutely.
Well, our evening is together is coming to a close. I know that one question I had is if we have time a little bit, when anxiety is causing some behavior problems, what is a parent to do? And that's very broad, but just if you have any ideas to leave them with, um, that's helpful.
Yeah. And anxiety definitely can cause behavior problems because kids either are overwhelmed by anxiety and then get into like fight or flight. Um, or because they're trying to control situations. And parents can always reach out to a mental health person, to try to help them with managing that behavior. But also, I think, again, kind of if anxiety is playing a role in it, really knowing it's going to be working over time with that child at developing some coping skills for anxiety and like trying to do preparation. So when something's changing, when a new situation is coming up, doing some preparation in advance of like, this is what we're going to do. These are you know, normal to feel nervous when we go to this new place. This is what you can do. You can take some deep breaths. You can say this to yourself. You can tell me how I feel and I'll squeeze, give you a hug. So just kind of working in advance and building those skills. But just to go back briefly, it is important to still have behavioral expectations, because if we just kind of abandon those because we feel bad that a child is anxious, that sends a lot of mixed messages and ultimately ends up backfiring. So that is a complicated question. I appreciate it, but yeah.
Thank you for attempting to answer it here at the
Yeah.
end. Well, I so appreciate this time with you and that our patrons had access to you. Thank you so much, Dr. Bredenstein. I believe that we'll be getting a survey out to our participants by email soon. And I just wanted to thank everyone, as well as our translators, um, for joining us this evening. Thank you so much for being with us. Thank you, Dr. Bredenstein.
Thank you
Take
so
good
much.
care.
Thank
Have a
you.
great night.
You
Okay.
too.
Thank you. Bye.